Welcome to the JOMA podcast, presented by the Jewish Orthodox Women's Medical Association. Every week, hear from expert medical professionals as they share up-to-date insights on health topics to help you live your best life physically, mentally, and emotionally. Join us as we navigate the ever-changing landscape of healthcare and strive to improve the health of the Orthodox Jewish community.
Hi, I'm Rena Goldberg. I'm a second-year medical student at Hackensack Meridian School of Medicine, and I'm here with the JOMA Specialty Spotlight podcast. The Specialty Spotlight podcasts are geared towards pre-med and medical students interested in learning about different medical specialties. Today, I'll be talking to Dr. Chani Yondorf. Chani Yondorf is an OBGYN at the Albert Einstein Medical Center of Philadelphia. She completed her medical school training at Albert Einstein College of Medicine in New York and residency at Albert Einstein Medical Center of Philadelphia. After completing residency, she took a faculty position at Einstein Philadelphia, where she is currently practicing. Chani is passionate about helping Jewish women navigate their gynecologic needs within the confines of halacha. She is often called upon by Rabbanim, Yoatzot, and community members to answer medical questions as they relate to Hilchot Nida. She has been able to carve out dedicated time in her office schedule that is reserved for Kalot and women with Nida concerns that may need more immediate medical evaluation from a halachic standpoint. Dr. Yondorf feels strongly about educating Jewish women and girls regarding changes they may notice throughout different stages of their life. To that end, she has spoken at educational conferences and events and hopes to empower Jewish women to understand their bodies and reproductive health. Thank you so much, Dr. Yondorf, for coming on the podcast.
You're welcome. Thanks for having me.
So just to begin, we're going to start off with like a little more of a broad question of what made you choose a career in medicine?
So that's a really funny question, actually. To be very honest, I was never going to be a doctor. It was not something I wanted to do at all. But growing up, my mom told me I was always going to be a doctor. And so obviously I was never going to be a doctor. And then I always loved math and science. So I knew I wanted to do something in that arena. I went to college and tried every single possible option other than medicine that I could think of. I tried engineering and patent law and anything sciencey, mathy, not doctory. And then at the very end of college, like my last year in college, I decided to volunteer at the emergency. I went to Stern, Yeshiva University, and so I was in the city. So I volunteered in the emergency room at Bellevue Hospital in New York, and I really just loved it. And I said, "Oh man, I guess my mom was right. I'm going to be a doctor." And so that's kind of, how I got into the career of medicine. Um, that's how I got here. Why did I end up choosing it? Or like, why do I like being a doctor? Um, because I love the ability to take the science and, the amazing things that happen in our body, and the fact that I really have a good understanding of all of that. And I can then take that and apply that to taking care of other people. Um, and one of the things that I love about my job is having a deeper understanding of what's going on and then being able to translate that to people so that when people come and they have a problem, um, kind of on that bridge for them, like, oh, here's this problem you're having, here's why you're having it. And now let me tell it to you in words that you can understand. So I love being able to like make that palatable for people and then help them understand what's going on with their bodies. And then, ultimately, obviously helping them get through that.
Yeah, no, definitely. I agree that that's one of the most incredible parts of medicine. I think the sort of bridging over the information to people that might not have understood it otherwise and helping them make the right decisions. What characteristics do you think make someone a good fit for a career in medicine?
I think it's probably a lot of the stuff that other people have said on, these podcasts. Like, I feel like we all kind of have that same idea, but obviously you have to love it because it's really hard to get through all of the training. And then even once you're past the training, like the life itself it's not a walk in the park. It's a really big, challenging career. It's a very rewarding career, but it's not an easy one. And so you have to really love it, because if you don't really love it, it's so easy to burn out of it. And then it just becomes a huge burden rather than, you know, something fulfilling. And so number one is just a real love for this sort of thing. I think that's one thing that, you know, is somebody who's going to be a good doctor, and then or is a good fit for medicine. Um, and then obviously a lot of grit and determination and willingness to like buckle down and, you know, get through that. But then in the long run, when you're actually, once you get past all the schooling and all the training and all of that, like when you're actually in the role of physician, I think that somebody who, like I said, you know, wants to be able to take their medicine and translate that into real world for people, and help them understand what's going on, you know, I think is a huge piece um, of the job. So I think that somebody who, you know, has that like kindness, compassion, patience, you know, to help somebody get through something that could be either very challenging in their lives or even very exciting in their lives, you know, is a you know, something that is helpful in this career.
It's funny because I find the first answer you gave connects to the second answer, that a lot of people try everything else in the math and science field because they're like, this is just such a big commitment. I have to love it. And those are the people that I find most of the time end up going into it. So it's interesting that that was your path too.
Yeah, yeah, it is a funny connection.
Okay, so you have a pretty grueling specialty. You're an OBGYN. So pretty hard specialty. Could you tell us a little bit how you decide to pick your specialty?
Okay, so I mean, what I liked about OBGYN is that um, a lot of medicine is kind of playing catch up, right? So you have somebody who's really, really sick, and you're just trying to help them get through that. And that can certainly be rewarding for, you know, a lot of different reasons. But I also found that to be really challenging and kind of sometimes a little depressing when I was, you know, going through all of my rotations. Like somebody who has, and, you know, somebody who's struggling with like, you know, horrible diabetes or bad hypertension. And, you know, they're never necessarily going to get fully better from that. You kind of have to manage that disease. And it's like this lifelong struggle to manage something that never necessarily gets better. And, you know, obviously it is certainly, you know, I don't mean to like put down any other field, but and it certainly is very rewarding when you can finally help that person get that disease under control. But for me, it kind of just felt like a lot of playing catch up and trying to like, you know, chase something that may or may not ever like come, you know, to fruition. But OBGYN was a totally different monster. Like, sure, you certainly help women who are struggling with lifelong issues. But what I love about OBGYN is that a lot of it is like just helping guide a woman as she goes through all of the different parts of her life, right? Because you can play a role in every single piece of it, right? When a girl is really young and she's, you know, going through puberty and helping her understand what changes her body is going through. And then when she gets her period and helping her figure out how to manage her period. What if her periods are painful? And what if they're really heavy? And how can you help her manage that? And then, you know, later on in life, when she gets older and she's ready to get married, and helping her, you know, understand, or helping her get like the contraception that she needs, and helping her like learn how to become intimate, and, you know, learning her body and guiding her through that process. Then she's ready to have a baby, and you can, you know, guide her through that super exciting moment in her life, as she, you know, navigates that, you know, piece. And then, you know, helping them manage as they get through perimenopause. So I just found like a lot of what an OBGYN did was, you know, guiding a woman throughout all of the different parts of her life. And I just love that piece of it. And you certainly take care of women who do have chronic diseases for sure. But like a lot of what you do, you're taking care of like young, healthy women as they get through something super fun and exciting. And I just loved that piece. I love being able to do that. And so I think that was, you know, some of the biggest draws for me.
You're selling me a little bit. I guess as a medical student going through rotations right now, and for medical students listening to this, I'm sort of realizing that you can drown a lot in the rotations and feel like, oh my God, how am I going to ever figure out what I want to do? Can you walk us through like how you picked OBGYN? Was it one of your first rotations? Was it like first right away you loved it? Just tell us a little more about that.
Yeah, for sure. I did not know what kind of doctor I wanted to be. I came into medical school totally a blank slate. I had no idea what kinds of doctor I wanted to be. So I think that that was very helpful. And then I obviously went into my third year rotations with a very, very open mind, saying, I will take each rotation, I will see what it actually means, and then I will make a decision. I think in general, the first thing, and I'm sure that again, you've heard this plenty of times as well, but like the first thing you need to decide is, do you want to do something medical or do you want to do something surgical? Because that's like a big dividing line, you know, in terms of like cutting. And they're two very different types of medicine. Do you want to do something surgical, OB, urology, general surgery? There's a lot of surgical subspecialties versus like the medical subspecialties. And that is one decision you need to make. Like, are you interested in working with your hands, managing surgical complications, you know, doing that sort of thing? Or are you much more interested in like handling the medicine behind it, and like, navigating, from a much more cerebral medical standpoint? For me, I had zero patience for rounding. Like, if I had to spend my day rounding, I would lose it. I couldn't do it. I had no interest in sitting there and perseverating over the like little details. It just wasn't for me. Some people love that, right? It is a huge knowledge craving, and it really can be intellectually stimulating. But for me, I was kind of bored, and I just needed to be doing something. I felt like I needed to be doing something. So I knew that I wanted a little bit more of a surgical subspecialty. Um, and then as I just went through it all, like I kind of saw what I liked, saw what I didn't like, and then made a decision. At the very end, I was really debating between OB and ER, actually. Those were the two things I was thinking about. I know it really is a very interesting dichotomy, I think. But I think they kind of somewhat are similar in that, like, I'm not dealing with somebody's chronic medical issues. I mean, I guess now emergency medicine is becoming more like that. But in theory, an emergency room doctor is somebody who handles a crisis and then moves on to something different. So, like, those were the two things I was considering. And then I think in the end, what won me over to OB was that I really wanted to have that relationship with the patient. I just found that there would be something lacking if I would like do my shift work and go home, and not ever like develop any sort of relationship with people. So that's kind of how I went towards the OB route rather than the emergency medicine route.
What challenges were there that you didn't really anticipate, and what challenges did you anticipate and sort of like prepare yourself for before going into OBGYN?
So I knew that at least during the training portion of things, that my hours were going to be horrible. And so when I was trying to decide, in terms of like where I should do residency and what I should do, I basically, I went into residency with two kids already. And I turned to my parents and I turned to my in-laws and I said, all righty, which one of you wants to raise two rambunctious little boys for the next 4 years? And, my in-laws were empty nesters and my parents still had, like a little kid at home. And so my parents were like, we can help, but we still have ours. And my my in-laws were like, none of our kids live near us. Come back here. We'll do everything. And so, that was a very big help. I think that I think in general in medicine, like it takes a village. If you really want to succeed, you know, it's funny, like we always say like, oh, women can have it all, and it's true, you can have it all, but you have to recognize that every single piece of having it, what that means to have it all, right? Like, I want a family and I want a career and I want a relationship with my husband and I want all these things, but like, am I going to be able to put my all into everything at every piece of my life? No, right? You can't physically do that. And so I was really fortunate that my in-laws are really amazing, and um they were willing and able to be my village when I was going through my training. And so, you know, without in-laws, like it's also doable, right? You need to get a good live-in babysitter who can be there for you all the time. For me, that was certainly something I toyed with, but I really would much rather have somebody who like knows my kids and, can say Shema with them at night and all of that sort of thing. And so I came, we ended up going with my in-laws, and my parents were very helpful as well. They also certainly pitched in, but like we live 5 minutes from my in-laws. They were there every morning. Before I left to work, they were there until I got home from work, and they helped with every single piece of like raising my children and also making me Shabbos and going grocery shopping for me and doing my laundry. And they're just like amazing. So, um, you know, going into this field, I knew that there was no way I could manage it all. And so I lined up my cards so that I had the help I needed to make it possible. So that way, when I came home, even though it was like incredibly late and I barely saw my kids, I got to spend the, you know, 30, 40 minutes that I had where before I crashed and before my children crashed. And I got to actually spend that time as quality time with my kids rather than spending that time doing the laundry or, you know, doing the groceries or cooking or whatever it was because my in-laws were so helpful in every space of things. So that I think is one piece to just recognize that like you can do it all, but only like with really good help. Um, so that I think was helpful. For me, I think one of the most challenging things that I had to navigate was working on Shabbos. I never had to do that before. I went to medical school at Einstein, which back then was controlled by YU. So there wasn't really that expectation that you were going to work on Shabbos as a medical student. I didn't have to deal with that or navigating that path. And then in residency, as an OBGYN, I don't think there is such a thing as a Shomer Shabbos OBGYN residency program. When I was figuring out where to rank, like when I was working on that, the place where I ultimately did rank, they called me, a little bit before the rank lists were due, and they said, "We really want you to come here. If you come here, we'll never make you work on your holidays. We can't guarantee you Sabbath, but never holidays." And so, that automatically bumped them up like quite a few
Awesome.
notches on my rank list. I ultimately did match there, and in the beginning, I had to work on Shabbos. I'd say at least 2 to 3 Shabbos a month, which was for me, I think one of the biggest challenges trying to navigate that piece. Um, Everybody will do what they will with their like observance of Shabbos in the hospital. For me, I did not want just the fact that I was a doctor to be a carte blanche to be able to do whatever I wanted to do on Shabbos in the hospital. So I really spent a lot of time learning Hilchot Shabbos, learning what I could do, what I couldn't do, who was a chola sheyesh bo sakana, she'ein bo sakana, what sort of things I was able to do. But leaving my house on Shabbos and going to work and being in a hospital was probably for me one of the hardest things that I had to do. But again, everybody is different and everybody will find their like that piece that was the most challenging. Um, but residency is short, right? I mean, it's long, but it's short, right? They say whatever the days are very long, but the years fly by. That's kind of how it goes. And once it's over, it's over, and then you get to like really have your own life.
That was my next question, actually, that I was thinking. Today, I actually had an attending tell me when I was talking to her how she figured out what field she wanted to go to. She was telling me about how a lot of people think about the residency and the training and what type of training they would want to be in. But realistically, it's going to be the rest of your life that you're going to be doing this job. So it's better to sort of think about how the job is going to be. So I guess we discussed a lot about the challenges with balancing a family and the demands of training. But I guess could we talk more about now that you're an attending and some insights in balancing that, if it's gotten easier, just a little bit about that.
Oh yeah, night and day. There is no comparison. I think that in the end of the day, you have to figure out what pieces are important to you. And the truth of the matter is that you can really tailor your job to what it is that you want. And I think that my job will change as I go through different stages of my life, right? Um, so right now my kids are still kind of young And so I am at a much bigger practice where I only have to take call 2 to 3 times a month, which really is not a lot. The calls that we do are 24-hour shifts, which means like when I'm on, but when I'm off, I'm off. And when I'm not on call or in the operating room, I'm in the office. And so, my day is 9 to 5 like everybody else's day, which is really nice. Um, Learning how to like manage all of your responsibilities within that 9 to 5, I think just takes practice. Because you're seeing patients from 9 to 5, but then when do you review your results and all of that other stuff? And I think that a lot of that is really figuring that out, learning the ropes, learning where you can find spaces of time during your day so that you don't have to bring work home with you. But I think that, for right now, my life is pretty manageable. I take my kids to school every morning, and I'm not there to pick up. Listen, I'm still on carpool line, so I certainly don't make it for for carpool line. But like, you know, my husband's an anesthesiologist, and so he leaves really, really, really early in the morning, but he's home by 3. So, I am there to take my kids to school in the morning, and, my husband picks them up, but I get back by dinner, it's not that big of a deal. So, for the most part, that's my day, that's my life. And then I'm in the OR once a month. I'm on call a couple times a month, but life is so much more like manageable.
No, I feel like it's important to hear that part because I really feel like at least a lot of what I'm thinking about is the training and what I'm going to be going through for the next X years. But it's good to hear, even in the tougher fields to train, that it is manageable once you get out of the training.
Yeah, and I also think that there are different jobs, right? So the place that I work at happens to be a very family-friendly place. And so even like when I was pregnant with my daughter, I had my 2 boys, I had them in medical school, and then I didn't have my daughter until I finished residency. And so when I was pregnant with my daughter working as an attending, my the my boss came over to me and he was like, "Listen, like do what you want and I'm happy to support you in anything you want, but like once you have your daughter, do you want to come back only part-time? Like instead of working 5 days a week, we can let you work 4 days a week, like if that works for you." So like I work in a big enough department that like really I can kind of do what I want with my job. Obviously, that stuff comes with like variations in pay grade. And so you have to figure out like what monetarily you can afford and can't afford and like how you can make things work. But for me, I wasn't quite ready to go part-time and I, you know, was able to manage it full time. I probably will go part-time at some point just for my own peace of mind. But like right now I'm perfectly, happy to go with this. And if I see that it's becoming too much, I know that like the place that I work is a very supportive place. Now, I will say that that's not true for everywhere. There are certainly attendings who I work with who have come from other institutions who have said the reason that they left was because, whenever they would have like life-changing events, like their bosses were like, well, you work here and this is what you have to do. And so I'm lucky that I don't work in a place like that. My colleagues are super supportive. Like for example, my son's bar mitzvah is coming up, Mirza Hashem, this summer. It's very exciting, and turns out that he's putting on his tefillin the day after Shavuos, which happens to be an OR day for me. So I was a little bit bummed because any other day, if I was just in the office, I could ask my office manager to just open up my hours late. So instead of starting at 8:30, I would start at 10 that day and be able to, go to Minyan for my son's Hanachas tefillin. But in the OR, like, I can't really do that, The OR starts early, you have to be there early, there's no, like, kind of navigating that around, and so I just reached out to, the person who, like, runs all of our ORs, and I said, "Hey, in June, can I switch my OR day with somebody else and do office hours that day and open my office late?" And she's like, "Yeah, of course, you shouldn't miss that celebration." And this is, like, somebody who's not Jewish, doesn't understand like, it was really hard to explain, it's not everyone understands what a bar mitzvah is, but people are like, "What? He's putting on these, like, black wraps?" And I'm like, "Just,
It's
a piece
important.
of it, I don't wanna miss part of the celebration." And they were like, yeah, they didn't question me, they didn't look at me like I had 3 heads. They're like, "Oh, this is important to you and to your son? Yeah, let's finagle the schedule so that you can, of course, be there for that." So, I think that it's important to find a supportive department, and you probably sometimes you can't find that on the first go around, but I was lucky that I did, but I think it's totally manageable.
So I know you're involved with advising rabbis and yoatzot about some like medical implications of Hilchot Nida. So I want to know if you could discuss maybe a bit of your work there and how you integrate that into your work as an OBGYN.
So that actually is probably my favorite part of my job. It's funny. I didn't want necessarily to be a general OBGYN. I actually went into OBGYN wanting to do REI, which is reproductive endocrinology and fertility. That's what I wanted to do. Um, but my husband was 4 years behind me in the training process because he only decided to go into medicine later. And so he would have been applying for residency the same year I would have been applying for fellowship. And since there's no like, couples match in that sense, I was kind of like, we didn't want to both be going through a match at the same time, especially since a fellowship match is earlier. So I would have to match first, and then he would be stuck and limited as to where he could apply for residency. And I could get a job without a fellowship, but he can't really get a job without a residency. And so I decided I would take a back burner on the fertility journey. And, for 4 years, I would practice as a general OBGYN. And then, or depending on where he matched, I would apply the next year for infertility. That was kind of like my initial thought. And then I started working as a generalist, and I realized that there is so much that I could do for our community just as a general OBGYN. And I found that to be so fulfilling because, there is like nothing more rewarding than being able to have a woman come to you and talk to you about like the issues that they're having that are totally not medical, but are really significant from a religious standpoint, and to get it, Because how often do you go to your gynecologist and you're like, but the spotting is crazy? And the gynecologist is like, yes, that is part of the deal. And they look at you like, what is driving you up a wall? And you're like, you don't understand. This is significantly impacting my marriage, right? Um, but like I do understand, which, I kind of compare it to like when you see a patient who doesn't speak English. And again, this is something like you really understand it when you like are working within like the floors. You see a patient who doesn't speak English. And so you have to do that entire visit with a translator. And like, do you really understand what they're saying to you? Do they really understand what you're saying back to them? There's a disconnect, right? Because there's a translator there. And so it's not the greatest connection. And I feel like the same is true when you're going to your gynecologist with some religious problem that is also, you know, you need their help to navigate it, but like they don't really understand your religious problem. But I do. Like, I speak both languages and I speak them both fluently, and, like, that really removes, like, a huge barrier, and so seeing, religious women who are struggling with NIDA issues or, calls before their wedding or any of those sort of things is really, um, one of my favorite parts of my day. So much so that, like, I was able to talk to my boss about the fact that like sometimes, women have these issues and they need to be seen fairly quickly, right? In our world, an engagement can be as quick as 6 weeks, 2 months, 3 months, right? It can take that long to just get into a gynecologist if you're a new patient. And you really want to get in soon so you can get started on whatever medication it is you're going to take to help, manipulate your period before your wedding, or if you're having a NIDA issue and like you really need to see somebody really soon so that they can figure out what's going on, because you don't want to wait a month before you figure that out in terms of all the spotting, or if you need to figure out if it's a maca or not a maca or whatever it is that you might need. A lot of those problems, while medically not critical, religiously need fairly quick turnaround time in terms of getting an appointment. And so I spoke to my boss and I said, I want to be able to make that availability possible. And so we turn around, we look at a problem, we figure out a solution. And I was able to set aside, a couple of consult slots in my schedule that are reserved. So nobody has the ability to put a patient there except for me and my staff. So if, a Kala needs an appointment, I have that saved for her. We obviously didn't want to waste that time. And so basically, like, the week before, if it's not filled, then that slot gets open for other patients and anybody can book there. But, that gives people the ability to get in within a week or two, even if you're a brand new patient. And so, you know, it's just, it's so nice for me and it's nice for the community. Um, and then, obviously, like a lot of Rabbaim do get my number, yoatso do get my number, and it's perfectly fine because I'm so happy to help them understand what's going on. Um, like I said, it's what gives me like a big sense of like satisfaction in my job that like I'm able to like utilize both of my expertise in medicine as well as my expertise in halacha. Obviously, I'm not a posek or a yoetzet or anything, but like I know the roles, and I can speak both languages, and so I love that role that I play. Oh, and I
So
guess
that's
circling back, I found so much satisfaction in that that when it came time for like my husband to be finishing up residency, I turned around and I was like, you know what? I don't really want to go back and do a fertility fellowship because there are so many from REIs, but like at least in Philly, I think I'm the only from OBGYN. And so like I don't want to give that up. Um, and so I chose to stay as a generalist.
a good thing your husband decided to apply residency then.
Yes, absolutely. It's funny where
Um,
life takes you. You can have a
yeah.
plan, but in the end of the day, you just got to be flexible because you really never know where things are going to end up and why they happen that way.
Can you tell us a little bit how you got involved with Joma?
So I got involved in JOMA actually because of your mom, because I live in Philly and your mom is from Philly. And I think your mom was one of the first people who also was a big, founder of JOMA. And so we were chatting at a shul kiddush as one will do. And she was telling me about this organization. And I forgot if she had asked me to like speak on a topic or just was like talking to me about it. I was like, oh, this sounds really really cool, really interesting. And that's kind of how I, found out about JOMA and became involved in JOMA. And then I think the way I really became involved, I think many years ago that JOMA was doing a program for like I want to say chronic pelvic pain or something of that nature. And they asked me to like talk about it. It was like a women's health something. And so I spoke for one of the JOMA events and I was like, wait, why am I not actually part of this? And so that's when I became like an official member of JOMA. Um, and yeah, I guess the rest is history.
I also got involved through my mom, so
Would you look at that?
yeah.
She's a
No,
very
I
influential lady, that Dr. Weinberger.
exactly. No, and just like listening to you talk about navigating the field, having kids, and just have gone to the JOMA conference. What was it, like a couple weeks ago? It was so interesting because I was in a meeting with we have these like small groups in medical school so that you like know um sort of faculty more on a personal level. And we were meeting in our small group and someone was like talking about how in their pediatric rotation it made them realize how much they wanted kids, and the faculty member was like, oh, definitely don't do that in medical school. I'll give you a whole nother lesson on like when exactly you're training it's good to start having kids. And it was like so cool that I could talk to people like you and go to a JOMA event where so many people are in medical school and having kids and in training and having kids. So thank you guys.
Yeah, I think JOMA is, it's great for medical students, and it's also great for us as attendings too, to like just, you know, it's hard to navigate both lives and your fellow colleagues don't always really understand what you're going through, but to like, fall back on a group of women who are actually dealing with every single same problem and, getting through it, um, you know, seemingly beautifully and be able to get the chizuk that you need from like everybody else, I think is huge. And I agree with you. A lot of like, your mentors who aren't Jewish don't understand what a Jewish lifestyle is necessarily. And so they don't realize how important it is to kind of do both things at the same time. And so that's kind of why they feel that way. But yeah, it is doable as long as you have the support you need. And that's kind of, what makes Joma so amazing because like we're that support.
The best. One last question before we end. Can you give any advice to either a pre-med student or someone in medical school right now? Just the last piece of advice or insights.
I think what I would have to say is probably going to echo a lot of what we've said so far, but medicine is both challenging and rewarding. And you should go into it with all of your heart and soul and do what you love, because every piece of it is hard. And so you might as well enjoy what you're doing. You might as well enjoy the ride as you're going through it. Um, and just always remember, like, Gamze Ya'avor, when these hard things come about, like they do pass. And, you know, sometimes you're faced with difficult things, but a lot of times you're faced with really empowering and rewarding and satisfying things. And so it's nice to kind of keep a diary of those good things that happen, because then when you're having hard days, you can go back to those good things and be like, oh, but remember how good it felt when X, Y, and Z happened. And remember why it is that you're doing what you're doing, because not every day is roses and rainbows. It's really not. There are bad days. But then the good days so outnumber it. So it's important not to lose sight of all the good stuff that happens. Um, that I think helps get you through, sometimes the things that are a little bit more challenging.
Yeah, no, that's great advice for any medical student, because it's, as we've talked about a lot throughout the podcast, that it's a very long journey, and as you just said, a lot of times, definitely parts that aren't as happy as others. So it's great advice. Thank you. I'm definitely going to take it for myself too.
Yeah.
So thank you so much for coming on, Chani. We really appreciate it. I learned so much about OBGYN and you. Thank you.
Yeah, you're very welcome. Thank you for having me.
Of course.
Thank you for listening to the JOMA podcast. We welcome your feedback and ideas for future episodes. Send us an email at health@joma.org. Don't forget to subscribe, rate, and review us on your favorite podcast platform.